तो मेरा कहाँ से
हेलो हेलो हेलो
हेलो, गुड आफ्टरनून सर।
हाँ डॉक्टर अनुपम, मेरी आवाज आ रही है?
हाँ जी सर, आ रही है सर।
ठीक है और वीडियो भी आ गया?
हाँ जी सर, आ गया।
ठीक है ओके।
So good afternoon all. Today, on the behalf of Department of Community and Family Medicine, AIMS Bilaspur, we are holding a national webinar, Front of Package Labeling (FOPL) as an essential tool to address the non-communicable disease burden in India. Now, I would like to invite Dr. Anupam Prashar, Professor and Head, Department of Community and Family Medicine, AIMS Bilaspur. Ma'am, please.
Good afternoon. Am I audible?
Yes ma'am, you are audible.
Thank you, sir. So, respected Director, sir, Dean, sir, Mission Director, National Health Mission, Himachal Pradesh, chairpersons and speakers who are senior faculty members from field of community medicine and pediatrics across the nation and participants of this webinar. On behalf of Department of Community and Family Medicine, All India Institute of Medical Sciences, Bilaspur, it gives us immense pleasure to welcome all of you to a national webinar on front of package label as an essential tool to address NCD burden in India. As per the report of NFHS 5, the obesity trend has increased exponentially among adolescents and young adults. The increased prevalence of obesity and its association with NCDs imply the need to apply social policies to curb this tendency as a public health priority. In this regard, the sustained implementation of policies based on scientific evidence and the promotion of healthy eating habits is important. In this context, AIMS Rishikesh is implementing an awareness-generating project entitled Healthy Food for All for building up of a national coalition of medical colleges, public health associations for creating demand for FOPL by highlighting medical issues which are preventable in nature. This webinar is being organized by AIMS Bilaspur in collaboration with AIMS Rishikesh as a series of national webinars for this awareness generating project. Through this webinar, the efforts will be targeted to mobilize influential voices from policymakers, academia, and professional bodies from each state. And this time it is state of Himachal Pradesh, which in turn will create a great movement for advocating regulatory safe food policy, especially front of package labeling in India. With this brief introduction to the topic of a webinar, I shall now invite our worthy director, sir, Professor Veer Singh Negi, for his inaugural address. It was his vision and leadership which has been instrumental in making AIMS Bilaspur operational in a short span of time. Sir is MD Medicine, DM Clinical Immunology, Fellowship. He's a Fellow Royal College of Physicians, London, FACR, FIMSA, and FICP. He has been conferred the prestigious Dr. B.C. Roy Award for 2017. His areas of interest are genetics in autoimmune diseases, pathogenesis of rheumatoid arthritis, and lupus. He has contributed immensely to medical care and education. He has established Department of Clinical Immunology at JIPMER Pondicherry, established India's first immunotherapy stem cell therapy unit at JIPMER. First international Kotal PhD program for India was started by him. He is visiting professor to various international universities, member technical expert committee for Prime Minister Swasthya Suraksha Yojana. Sir, I request you to kindly deliver your inaugural address. Sir, please.
Good afternoon. I hope I'm audible to everybody.
Yes sir,
Yes, sir.
you're audible.
Yeah. So I welcome all the faculty and participants to today's webinar, which is being hosted jointly by the Departments of Community and Family Medicine, AIMS Bilaspur and AIMS Rishikesh. Due to rapid urbanization and changing food habits, our country is undergoing an epidemiological transition from communicable to non-communicable diseases, which are now responsible for a majority of deaths worldwide. We are facing major diabetes and obesity crisis among adults and growing child obesity problems, that too with malnutrition. Nutrition has been identified as the largest modifiable risk factor for the increasing burden of NCDs. High intake of healthy, unpackaged packaged and processed foods containing empty calories are major drivers of overweight and obesity. These foods have excessive sugars, total fats, trans fats, and sodium that are referred to as critical nutrients of public health concern. The excess intake of these critical nutrients, driven largely by widespread availability, affordability, and promotion of processed and ultra processed food products. These products are advertised very well, available in ready to eat state, leading to their widespread use by all classes of society, be it the rich or the poor. Therefore, there is need to educate the public about their harmful effects. Nutritional education and interventions can promote healthy dietary habits and may in turn force the manufacturers to come out with healthy products. In this regard, front of package labeling is one of the interventions which has been proven to promote changes in the packaged processed food supply. It enables customers to identify products high in sugar, sodium, saturated fats, which are critical nutrients, as I mentioned, associated with NCDs. These they present simple and graphic information on the nutrient content or nutritional quality of the products. And if advertised well with nutritional public education, these public education programs can help the consumers to make informed choices related to healthy dietary habits, and probably they may lead to regulatory food policy changes also. Today, we are going to discuss these issues in this webinar on front of package labeling as an essential tool to address the non-communicable diseases burden in India. I hope that the discussions and deliberations will have long-term beneficial outcome. I once again welcome you all to today's program. Thank you and Jai Hind.
Thank you, sir, for your words of wisdom. And we at AIMS Bilaspur are really blessed to work under your guidance.
So now I would like to invite Professor Dr. Sanjay Vikrant. Sir is Dean Academics at AIMS Bilaspur. He is also Head of Department of Nephrology. Sir has done MD Medicine and DM Nephrology. He is fellow of various prestigious societies in field of nephrology. He has been conferred with merit awards by Governor of Himachal Pradesh. Sir is instrumental in establishing Department of Nephrology at Indira Gandhi Medical College, Shimla in Himachal Pradesh. The areas of specialization include clinical nephrology, peritoneal dialysis, hemodialysis, plasmapheresis, intervention nephrology. Sir, please.
Good afternoon. Am I audible?
Yes, sir.
Respected directors, sir, esteemed chairpersons, distinguished speakers, and dear participants of national webinar on front of package labeling, an essential tool to address non-communicable disease burden in India. India has seen a rapid increase in intake of ultra-processed food at home and away from home, like sugar-sweetened beverages, instant noodles, confectionery items like chocolate, and fast food such as burgers, pizzas, fries, deep-fried street food. With emergence of all these ultra-processed foods and beverages and unhealthy food and fast food, we can see sale of these products in every nook and corner of the country. In fact, they are sold in every village, squatter area, and food-related stores. These food items are high in fat, salt, sugar, and high in calories, high on chemicals, preservatives, stabilizers, flavorers. They are attractively packaged and widely advertised and aggressively promoted. Besides having a bad nutrient profile, they are addictive in nature. Ultra-processed foods they lead to non-recommended dietary practices like overeating, mindless eating, fast eating, and promote excessive energy intake. They are more widely available and accessible than the real foods like fruits and vegetables. They are sold in cheap, small packages almost everywhere, replacing the classical balanced thalis. Ease of access to energy-dense, inexpensive processed food has resulted in obesity and non-communicable diseases among children, adolescents, and adults. And worldwide, almost a quarter of population are overweight, and this problem of overweight and obesity has tremendously increased in past 40 years. It is estimated that the obesity and overweight has increased by 30% among adults and almost 50% among the children. There is a French proverb, you dig your grave with your teeth. Childhood obesity or overweight places them at an increased risk of high blood pressure, development of coronary heart disease, stroke, cancer, and our diabetes already in the middle adulthood. Globally, many countries have introduced policies to modify nutrient intake of public. Of these, front of package warning labeling is a simple, practical, and effective tool to inform public about the products that can harm health. It works just the way cigarette packets are labeled with images to discourage consumption. Most shoppers spend a few seconds in selecting each item, which does not give enough time to compare the nutrient facts panel that are found on the back of the packaged foods. Since dietary habits are important in the management of non-communicable diseases, an improvement in nutrition level is required. So, front of package labeling might be a beneficial by quickly informing consumer about the relative healthiness of the products or warning them of products which are excessive in added sugar, trans fat, saturated fats, and high in sodium, which are main culprit or risk factor for most of the burdensome diseases. These words, I welcome you all and extend my thanks for joining this webinar. I am sure that the deliberation during this webinar will be beneficial to all of you. Thank you once again and Jai Hind.
Thank you, sir. So now
May I request all the speakers and chairpersons and dignitaries to please switch on their mics. We can have one group photo. Sir, with permission of ED, sir, please. Sunila ma'am, please.
My video is on. Can you see me?
Yes, ma'am, but your face is not clearly visible. I mean, you have to adjust your screen. Yes, ma'am. Now it's okay. You're done? Okay, thank you. Thank you all.
So now I would like to invite Dr. Anupama Dhiman, Assistant Professor in Department of Community Medicine, to start this academic session for today's webinar.
Thank you, sir. So starting with our first session, I would like to invite our first chairperson, Professor Dr. Neeraj Agarwal, Medical Superintendent and Head, Department of Community and Family Medicine, AIIMS, Bibinagar. Earlier, sir has served as Dean at AIIMS Patna and AIIMS Bibinagar, and he has been awarded an Innovation Award by Ministry of Health and Family Welfare in Poshan Mark Award ceremony in 2018. His area of interest are iodine deficiency disorders, maternal and adolescent health, non-communicable disease, and COVID-19. Sir has conducted various projects related to these fields. Welcome you, sir. Our second chairperson for first session is Professor Dr. Anmol Gupta, Professor and Head, Indira Gandhi Medical College, Shimla. Sir is a recipient of Harcharan Singh Oration, Vasudev Oration, and he's a semi-finalist for Coach Award in 2021. Sir is a principal investigator for 15 projects funded by different funding agencies. He is a chairman state OR committee for RNTCP Himachal Pradesh. Sir has been secretary for Mother Global India. Welcome you, sir. Now I hand over the session to our chairpersons for conducting the first session of this academic event. Thank you, sir.
Thank you. Dr. Neeraj is there.
Good afternoon, sir. I am
Okay,
here.
Dr. Neeraj.
Yeah, good afternoon, sir.
You may
You
start.
introduce Dr. Pankaja.
Okay. At the outset, I am grateful to the administration led by Professor Veer Singh Negi, who is the Executive Director, and Professor Sanjay Vikrant, Dean Academics of All India Institute of Medical Sciences, Bilaspur, along with the organizers, Dr. Anupam Prashar, Professor and Head Department of Community and Faculty Medicine, AIIMS Bilaspur, and Dr. Pradeep Agarwal, Associate Professor, Department of Community and Family Medicine, AIIMS Rishikesh, for giving me this opportunity to chair this very important session on FOPL as essential tool to address NCD burden in India. As all of we know, it is one of the key policy tools to regulate such products to prevent them from unbalancing diets is the use of front of package labeling to indicate consumers which products contain excessive amount of sugar, total fat, saturated fat, trans fats, and sodium. With this, I invite our first speaker, Dr. Pankaja Raghav, who is going to deliver on a topic that is burden of non-communicable disease and role of diet in NCD control. Dr. Pankaja Raghav is a FIMER fellowship. She is Indian Public Health Association fellowship, Bharat Vikas Award in the field of occupational health. She is the member of WHO Regional Advisory Group for Ear and Hearing in Southeast Asia region. She is the master trainer on test, treat, and talk anemia under the Mukt Bharat strategy in the various components. And she is the member of National Task Force of COVID-19 OR group health research, and she is subject expert of faculty recruitment at AIIMS Bibinagar and member Institute of Body AIIMS Madurai. With these words, I welcome Dr. Pankaja Raghav and ask and request her to start with his topic. Dr. Pankaja Raghav, please.
Thank you, sir. Respected Executive Director, Dr. Negi, sir, Dean of AIIMS Bilaspur, Chairpersons, Dr. Neeraj, Dr. Anmol Gupta, Dr. Ashok Bhardwaj, sir, and organizers, thank you for
Dr. Pankaja, we are not able to hear you. Yes, ma'am.
To share her screen.
shall I share or Anupam? I had already shared the PPT with you.
Ma'am, please share. Ma'am, please share.
You will have to remove this slide first.
Kritika has to remove her screen.
Can you see the slides?
Oh, no.
Am I audible?
Yes,
Yes.
ma'am.
You are audible, but your slides are not seen.
Actually, they have to remove their slide first.
And Kritika has to stop sharing screen.
Yeah,
Yes.
remove this also.
Yes.
Yeah,
Yes.
now it is visible. Yes, yes.
Thank you, ma'am. So, my topic is burden of non-communicable diseases and role of diet in controlling NCDs. So I will go through what is the burden of non-communicable diseases globally as well as in our country, and what risk factors are responsible for having non-communicable diseases, and what is the role of diet in controlling NCDs, and what is healthy dietary practices, and what are different strategies to control NCDs. So as we go through different ages, so first age is like age of pestilence and famine, where life expectancy was very less, under 30 years only. And then we moved on to next stage where we have started controlling pandemics, though last few years we are still experiencing pandemic. But during this phase, definitely life expectancy has improved and it is over 50 years. And now we are in the age of degenerative and man-made diseases, where we are going through the menace of non-communicable diseases, and slowly we are improving on infectious diseases. Though for our country, we can say that there is definitely burden of communicable diseases, as well as we are having increasing burden of non-communicable diseases. So as we all understand, non-communicable diseases are chronic diseases with long duration, and it is definitely multifactorial. And the major non-communicable diseases where they share the risk factors, and these risk factors mainly are alcohol, tobacco, unhealthy dietary practices, and less physical activity. Definitely in this century, we are facing this challenge, and it's a major public health problem. And not only there is impact on health of the people, but yes, economy of our countries are also suffering. So when we look at the magnitude of problem, NCDs kill 41 million people each year, which is equivalent to 74% of all deaths globally. And each year, 17 million people die from NCDs, and that happens before 70 years. So life expectancy is less because of non-communicable diseases. And 86% of these premature deaths occur mainly in low and middle income countries, and we are part of low middle income countries. Of all NCD deaths, 77% are common in developing countries like us. And major non-communicable diseases are cardiovascular diseases, which top the list, followed by cancers, and then respiratory illnesses and diabetes. And these four group of non-communicable diseases, they account for more than 80% of premature NCD deaths. When we look at projected global deaths till 2030, this mathematical model, when we are looking at this, we can definitely see the progressive trend, rising trend, when we compare non-communicable diseases with communicable diseases. We have started controlling communicable diseases, and the number is definitely a serious number. When we look at age standardized mortality rates due to non-communicable diseases per lakh population, countries are classified as type 1, type 2, type 3, and type 4 based on the income level. So type 1 means low income, and type 4 is higher income countries. And we fall in the category of type 2, lower middle income economies, and we can see the number is quite high. This is as per the different countries and non-communicable diseases deaths. So this number is very high. We can see India, it's totally red, and this is again a projection by 2030. So when we look at our country, these four major non-communicable diseases are very common in our country. They are cardiovascular diseases, cancers, respiratory illnesses, and diabetes. 1 in 4 Indian has a risk of dying from NCDs before they reach 70 years. In 2017, it was estimated that approximately 4.7 million deaths have occurred in India due to NCDs, and that comprised 49% of all cause mortality, of which cardiovascular diseases are 23%, and followed by that is chronic respiratory diseases, cancers, and diabetes. As it is happening globally also, premature death before 70 years contribution in India is 65%. Dialysis for NCDs is 47% in proportion to all cause dialysis. Hospitalization rate is also very high, which is increased to 38% due to NCDs in 2014. When compared to 1990 data with 2016 data about these major non-communicable diseases and dialysis due to these NCDs, we can see this. There is definitely a reversal. This 61% is because of communicable diseases, malnutrition, neonatal disorders, and now this is changed to non-communicable diseases. Exact reversal is seen. That means non-communicable diseases are increasing as compared to communicable diseases and other illnesses. Again, same, this is the death, and the earlier was the morbidity pattern. We can see the similar picture as far as mortality due to non-communicable diseases is considered. When we look at problem in women, the similar kind of picture is seen for the dialysis due to non-communicable diseases. It is definitely increasing for all major non-communicable diseases when we compared 1990 figure with 2016. This is very, very interesting map of epidemiological transition ratio, which is the ratio of dialysis caused by communicable diseases, malnutrition, neonatal and nutritional disorders to those caused by NCDs. When it is more than 1, that means kind of red, orange colors, that suggests deaths are more due to communicable diseases and other than non-communicable diseases. And this map is for 90, and when it is less than 1, that suggests non-communicable diseases have taken upper hand over other diseases. And you can see for range or spectrum of blue color is seen, that suggests Kerala is 0.16. That means more of NCDs. When we compare that with Bihar, it is 0.74. That is towards 1, means still they are having communicable diseases. So this is the kind of map when we are comparing epidemiological transition in different states of our country. So there are various risk factors for non-communicable diseases, and physical inactivity, unhealthy dietary practices, harmful use of alcohol and tobacco. They are the major risk factors, and definitely they are all modifiable risk factors, and they are the common risk factors for across non-communicable diseases. So when we look at unhealthy diet, definitely there is a transition. We have preference towards these unhealthy dietary practices. Maybe we are going for packed food, and our adolescents or children, they are fascinated towards those attractive packets, and even the portion size is also increasing. So there is a lot of preference towards this unhealthy diet, and it leads to a high calorie consumption. We are having high fat consumption, high salt consumption. So total unhealthy dietary practices, and if it is combined with lack of physical activity, that definitely leads to overweight and obesity. And we can see 1.9 billion adults are overweight and obese, which leads to other non-communicable diseases. So what happens when we start practicing unhealthy diet? As someone has rightly said, what we are what we eat. So there is direct relationship between what we consume and what we look. So unhealthy dietary practices, so calories through our food, like high fat, high salt, sugar, leads to a lot of non-communicable diseases, like starting from overweight, obesity, and then when we look at different evidences, different research papers, and otherwise also when we look around, as compared to these unhealthy practices, there is little consumption of, or very negligible consumption of healthy diet. Our diet is very less in fiber or fruit or green vegetables. So trend of consumption of processed and easy to take away foods is definitely rising, and unhealthy dietary menace has changed to food system and dramatic implication of NCD development. Healthy diets are unaffordable by our poor population, and they are also getting attracted towards this ultra processed unhealthy food, leading to poor health in this population as well. So what is the role of diet in NCD control? So as we know, and as I am also repeating, so it leads to overweight and obesity, high cholesterol, high diabetes, cardiovascular diseases, and other non-communicable diseases. Some cancers are also very common because of these unhealthy dietary practices. So what we should be doing? So definitely we should start.
Dr. Pankaj, can you conclude?
Yes, yes.
Dr. Pankaja, please
Yes,
conclude in a 5 minutes. Okay.
Yes.
So we can finish on time.
Last two slides. So we should inculcate healthy dietary practices from childhood. Like in our institution, we have started one project, that is healthy school and home dietary practices, where we have involved school teachers, school children, out of school children as well, and the parents. So we are educating them, and we are continuously in touch with them. They are sharing their plates on WhatsApp, and we are educating them for healthy dietary practices. When we talk about national level or at policy level, I can say that Mexico has really taken a bold and brave step. Maybe we can inculcate those practices in our country as well. So we can promote awareness practices. We can have nutritional education and counseling in schools, preschools. We can have taxes on the sugar sweetened beverages, subsidies on fruits and vegetables, We can have incentives as well. Then reformulation of food and drink products, limiting marketing and promotion of unhealthy food and drinks. And maybe in the next session, front of package labeling will be dealt with. That I will not go. And last is like a former WHO director Chan in 2014 rightly said, the challenges presented by these diseases are enormous. They demand some fundamental changes in the way social progress is measured, the way government work, the way responsibilities are assigned, and the way the boundaries of different government sectors are defined. Thank you.
Thank you, Dr. Pankaja. You had rightly set the motion for the conference and this topic. And now we will take a question at the end of the session as the time permit. So I will welcome the next speaker. Can you put a slide of Madam Dr. Sunila? Okay.
I think this is a Padnije, Dr. Neeraj.
Thank you, Madam. Director Dr. Negi, Dean Sir Dr. Sanjeev Vikrant, and I am proud. Really, Dr. Anupa had given me a privilege to introduce Dr. Sunila, who is the stalwart of the community medicine, and we are the student of her. So it's really my honor. I am honored to introduce her. Dr. Sunila Garg is the ex-sub-dean of Maulana Azad Medical College, Professor of Excellence and Associate Hospital. She is the chair in NIHFW, National Institute of Health and Family Welfare, PAC, National President of IAPSM and OMAG 2122. She is the Secretary General of okay, now they had put it. She is the member task force Department of Biotechnology, member Lancet Commission on Hearing Loss and Lancet Commission of COVID India Task Force, alumni London School of Hygiene and Tropical Medicine, fellow WHO DFID, awarded in Memorial Oration of IPHA, awarded Harchar Foundation Award, State Award for Meritorious Service, awarded Best Teacher Award. So she has so many things with her side. So I asked her to speak on the issue, and then we can learn a lot about from her. Welcome.
Thank you, Dr. Neeraj, for this humble words of introduction. I'm really, thankful, and really, I'm full of humility for all of you. Thank you so much. And the dear chairs, Dr. Anmol Gupta, Dr. Neeraj Agarwal. First of all, my big congratulations to AIIMS Bilaspur for holding this seminar on this webinar on this very important topic of concern. So I'll be sharing my slides first, and then we will go quickly to what is this front of package labeling, though you can see all the labels on the first slide. So I'll share my screen. I'll do that. Okay. So.
Excuse me, ma'am. Ma'am, will you share? We have already shared the screen. If you want.
No. I'll share my screen. So I've already done that, and then probably it's okay.
Yes, ma'am. Yes, ma'am.
Okay. So we all know that role of strong warning labels on unhealthy food products in protecting people's health was a theme of World Food Safety Day on 7 June 2021. It is very important that to learn about what is FOPL. It provides a quick and straightforward information to the consumers to identify foods and beverages which are unhealthy. FOPL is a part of comprehensive policy approach needed to promote healthy diets, and as already mentioned, they reduce overweight, obesity, and diet-related non-communicable diseases. And we all know, as Dr. Pankaja said, junk food has little to recommend it to the smarter parts of our brains, but to our impulsive side, it's the taste that matters. It's samosa, it's burger. This is what we like to eat despite knowing everything about it. Now, FOPL as a policy tool to the development, implementation, and monitoring, along with evaluation of FOPL, should be government-led with input from key stakeholder groups. which includes assessing the current dietary patterns and nutrition and health related status of the population. Number two, it is also based on the legal framework under which FOPL should be introduced and the interface with other legislations, relevant nutritional policies that FOPL would support. It is very important that it's a part of, our legal framework in a very, very, correct manner. So there has been, increasing global interest in nutrition labeling as a policy tool. So I'll read the bold part of it, that nutrition declaration should provide essential information about the nutrient content of the foods, but the complexity of the quantitative information on the back of the pack means that it is not readily accessible and it is often poorly understood. That is where is the challenge which we are facing with the food industry. So nutrition labeling has been considered as a policy implementation tool in various official WHO documents adopted by World Health Assembly. So the principal aim of FOPL is to provide actually the convenient and readily understood nutrition information given or on the guidance of front of packs to assist all the consumers to make informed food purchases and healthier eating choices. And also, the additional benefit is to stimulate favorable compositional changes to food products which are available in the retail outlets. And I'll be discussing this Nutri-Score and all subsequently. So what is the scope of FOPL? The priority focus or scope of FOPL is packaged, manufactured or processed foods that are required to carry a nutrient declaration presented as ready for sale to the consumer in the retail sector. FOPL is not appropriate for some packaged foods. Now remember this, including foods specially manufactured for infants or young children and infant and follow formula. Foods for infants and young children have strict compositional criteria. So here you do not require FOPL, it's not appropriate. Packaged foods that are exempt from displaying a nutrient declaration should not display FOPL. These include foods with very low nutritional contributions, such as if you are drinking green tea and all, they do not require, the front of package labeling, or tea or coffee or herbs and spices, etc. Now, already Dr. Pankaja has mentioned in big detail about non-communicable diseases, because we know that they are there because of ease of access to energy dense, inexpensive processed foods, which have very little nutritive value. Also, during COVID-19, we had, as India coped with ongoing burden of, COVID-19 that already strained our existing healthcare systems, with hospitals diverting resources and capacities to treat the infection. The NCDs are becoming an emergency we cannot afford to ignore, and NFHS data is in front of us, which is an eye opener for us. Now, what are the WHO's, best strategies? If you will look at the, point which is colored, tackling NCDs should have, basically one thing is that we should promote and support exclusive breastfeeding for first 6 months of life, including, basically it is not only exclusive, but subsequently also we have to promote breastfeeding. And also we have to implement subsidies to increase the intake of fruits and vegetables. And we have to replace trans fats and saturated fats with unsaturated fats through reformulation, labeling, and fiscal policies or agricultural policies. Implement nutritional labeling to reduce total energy intake in terms of kilocalories, sugar, sodium, and fats. And most important is the last point, that is you implement mass media campaign on healthy diets, including social marketing, to reduce the intake of total fat, saturated fat, sugar, and salt, and promote the intake of fruits and vegetables, which is must, but which is rarely done. So what is the global non-communicable disease target for 2025, which are diet related? Target 4 talks that we have to reduce, 30%, we have to have relative reduction in mean population intake of salt or sodium by 2025. And mean population recommended intake is now 5 grams per day, but then we recommend 2 grams per day. Target 6 talks about, adult raised blood pressure. We have to bring it down by 25%, and raised blood pressure means more than 140 by 90. Target 7 means we have to halt the rise in obesity and diabetes. Adult obesity is more than 30 kilogram per square meter. That is more than that is we call it as obesity. And adult diabetes is fasting glucose more than 7 millimoles per liter, and this is with on medication for a raised blood glucose, or with a history of, or diagnosis of diabetes. Now, what are the important policy strategies is, there are 3 important policy strategies which are recommended. One is front of package labeling. Second is restriction on marketing of these foods for children. Third is restricting the sales of these products in the schools. So this is one of the very, very important perspective from the, community medicine physicians also. Now, so food labeling is a tool to promote and protect public health by providing accurate nutritional information. It's an instrument for marketing and product promotion, and warning labels will help the consumers to quickly and easily identify ultra-processed foods and beverage products, herein by referred to as ultra-processed products high in sugar, sodium, and fat. Another thing, what are the ingredients of concern? We talk of total calories, we talk of saturated fat, trans fat, we talk of sugar, and we talk of salt as well. Now, when we look at it, how we have to label, there are 2 components of labeling. One is part 1 and second is part 2. Part 1 deals with the energy, total fat, trans fat, total sugar, and salt per serving. This is salt per serving. And part 2 talks about, this is per serving, contributing to recommended daily allowance. And recommended daily allowance, let's say, we are taking 400 calories, but our recommended daily allowance is 2000 kilocalories. So you can see down below, it is 20%. Okay. So then the second part is when we talk about if it individual is taking 6.7 gram, but recommended is 67 gram of total fat. So this means 10%. But look at the salt component. Our salt component, becomes red because it is much more than the recommended daily allowance of 5 grams. So there are 15 guiding principles of front of package labeling. One is it has to be, aligned with the national public health, and nutrition policies and food regulations, as well as with the relevant WHO guidance and code lines. A single system should be developed to improve the impact of FOPL system, particularly for a country like India. We cannot have something like star rating, which recently came out, not easily understood by everybody because we are very diverse. Principle 3 talks of mandatory nutrient declaration on food packages as a prerequisite for FOPL systems. Principle 4 talks about we must have monitoring and review process, because we now is the time that public health professionals should develop M&E tools as part of overall FOPL system for continuing improvements or adjustments as required, whether it is fit for all or not. The principle 5 talks about aims, scope, and principles of FOPL system, which should be transparent and easily accessible. The government should lead the multi-sectoral stakeholder engagement process for development of trusted systems, including nutrient profiling criteria. The principle 7 talks about FOPL has got to be interpretative. That means it has got to be based on symbols, colors, words, or quantifiable elements. Principle 8 talks about the design of FOPL system should be understandable to all population subgroups and be based on the outcome of consumer testing, evidence of system performance, and stakeholder engagement. So we have to look at, how much stakeholders are involved, whether industry is also with us or the consumer is also with us. That is important, and that will be dealt in detail with by Dr. Thakur as well. Principle 9 should talk about content should encompass nutrient criteria and food components that aim to inform choice and enable interpretation of food products against risk for diet-related NCDs and promoting healthy diets. And FOPL system should enable appropriate comparisons between food categories within a food category and between foods with a specific food type also. Also, we need to see that, as I told you, it can be interpretative, it can be summative also. Interpretative talks about, if you can see, on my left side or on your right side can be informative and interpretative, which talks about the contents, how much they are, and, how much they are with regard to recommended daily allowance. And lower below, you can see, the summative part also, the summary part, whether we give overall a green label or not, that is important. Or you can see the Singapore Health logo, which is red, or you can see the Chili's logo, which is hexagonal and which is black. That means they talk about that they are high in that particular food stuff. So that is why we have to talk about, the nutrient. We can have either the nutrient based or we can have the overall package based also. So Nutri-Score, basically, if you can look at, and this is very important from the point of, our community medicine professionals, that it talks about energy, sugars, total fat, saturated fat, sodium and all that, and each is given 1 to 10 points. And we have a summation of, and as I told you earlier, that these are based according to the recommended daily allowance and per serving also. So the score is varying between -15 to 40. So if the score is -15, that is of highly, nutritional quality. And if it is red, that is 40, that means it is of low nutritional quality. And this was adopted, officially in France in 2017. So this was developed by academic research team and also France High Council of Public Health, and also French, Food Safety Agency also. So this is another way of looking at the foodstuffs, and you can see the Nutri-Score, which is given to total calories, salt, sugar, fat, and saturated fat, etc. So principle 11 talks about FOPL system should be encouraged across all eligible packed foods, either through regulatory or voluntary approaches. Principle 12 talks of early engagement of industry group, which is very challenging. And I'm sure Dr. Thakur will make a mention, and the development of guidance documents are necessary for facilitating implementation of FOPL system. Principle 13 talks about engagement with key population leaders, including food and nutrition experts and the media, which is very important. And consumers is essential and should be well managed. Principle 14 talks about well-resourced public education campaigns and consumer education with special consideration of techniques to target at-risk groups, which are necessary for improving nutritional literacy and consumer understanding for the use of FOPL system. And lastly, principle 15 talks about that baseline data should be collected to support monitoring and evaluation of its impact, FOPL's impact on consumers. And again, if it is not successful, then we have to do the reformulation of food products. Also, it is very important that governance of FOPL system should be done. If anomalies are not managed, they have the potential to undermine the credibility of proposed FOPL system. Example of such governance arrangements includes those supporting the health star rating system, which has been done by IIM people, at Ahmedabad, which we are, quite critical about that, because that will not suit all segments of population. We know about the Chile study, where you see they had, the foodstuffs which highlight, exceeded the limits. They put it in, as black and white kind of thing. And you can see this paper was published in PLOS One, which said that purchase of high in beverages, significantly declined following implementation of Chile's law of food labeling and advertising. This is where you can see then ultimately our food industries, they become very smart how to manage the stakeholders, that is the population and the governments as well. Also similarly, in Israel, they brought out this policy in 2021 where they had colored red the diet or the foodstuffs which were high in fat, sodium and sugar, but then green labeling was voluntary, which indicated that the food within the national nutrition recommendation criteria varies, and the food which will qualify for green label is the one which is based on nutrition specific guidelines, which is based on Mediterranean diet, which is mainly plant-based. So this is where the green labeling, but it became voluntary. But then it is very important to have the front of package labeling mandatory, which was made in Israel in 2021. This is being followed. Another thing which is important is with regard to FSSAI, it has got three components basically: draft packaging regulations, draft advertisement and claim regulations, and draft labeling regulations, which becomes very important. So it aimed at establishing requirements for labeling of pre-packed foods to provide simple, easy to understand information to the consumers and facilitate them in making healthy choices. And as I told you that basically it is based on the percentage contribution to recommended daily allowance. So that means a high fat, sugar, salt labeling is done. So mandatory declaration of these components, which have already been, I have told you, and this is what as per FSSAI, the package is supposed to provide. It has got to provide, the serving size and number of servings and the components with regard to energy, protein, carbohydrate, sugar and fat per 100 gram or per 100 ml, because we have sweetener drinks also, and percentage of recommended daily allowance, that is important. So we got to have mandatory declaration of all these components. So this is very, very important as per FSSAI norms. So FOPL initiative in India in 2018, Food Safety Standards Authority of India published the draft regulation for front of packed nutrition labeling and made them available to public online, which considered symbols, nutrient profiling models. It proposed a format based on nutrient level cutoffs derived using the recommended daily allowance for the Indians. So, so far multiple discussions have been held. In 2020, again, the discussions were held. They were revived with a positive way, and the working group was working on the development of nutritional cutoffs and labeling design. In 2021, FSSAI is closing on FOPL system that was agreed upon, and we as public health community should be advocate for strong interpretative FOPL in India to reduce mortality and morbidity due to NCDs. And you see, now recently we came out with the star rating part, but that has got its own concerns, because you see, the proposed labeling format, it aims at only people who are literate and nutritionally aware. Almost a quarter of Indian population is illiterate. Therefore, pictorial representation should allow better engagement and understanding. It is crucial to have positive participation of the food industry. Unfortunately, Indian food industries have expressed many concerns, rightly so, because you see, they are going to do so over the proposed format, especially using the color red, as it indicates danger and could dissuade consumers from their product, because they are industrialists. That is what it is important to understand. They argue that positive and voluntary labeling is accepted in many countries and should be encouraged in India, where the need of the hour is mandatory FOPL using the consumers and stakeholders' inputs. Now, another thing which is very important is that, what is being dished out to our children on the TV screen. According to various reports, the fast food industry is increasingly eyeing on children as their potential food consumers, with kids seeing ads as they're growing, as young as 2 years old. Now, children are now seeing 33% more fast food ads as they did 6 to 7 years ago, while they're preschoolers, and they see, so this is alarming picture. So measures such as mandatory FOPL and marketing restrictions are one of the few of the solutions that can address diet-related disease epidemics, or I'll say pandemics also. So world over, food industry is very smart, and we as public health professionals need to deal with. So a need of the hour is to have a effective implementation of FOPL system, which requires well-resourced and robust consumer education program, and which will provide key information about FOPL as a wider suite of the country nutrition messaging and as a dietary guidance also. So it is very important to see what works for India. There are 5 steps. Select specific strategy, what is expected from FOPL, select the type of FOPL and graphic design, determine the underlying nutrient profiling system, define studies to be performed to select the final format, and then accordingly you must have monitoring procedures whether it works or not. And recently, ultra processing product industry has shifted its stance from opposing FOPL to weaken the policy standards, and rightly so, because that is an industry. And in 2021, the Global Health Advocacy Incubator monitored UPP industries' attempts to weaken FOPL standards in 20 geographies. This report highlights different actions and narratives by the industry. So basically, why they did so? Because it is to protect ultra processing products industry's reputation and brands through corporate washing, influence policies through multilateral bodies, to delay implementation and threaten countries with legal and economic concerns, divert attention from the corporate responsibility on the damage to environmental and human health to blame individuals for their behaviors. That is very important. You behave individuals for the behavior rather than, and do not have front of package labeling in the place, and imply that the products contribute to health, environment, and society while blocking the development and implementation of healthy food policies. That is important. So to conclude, what is the way forward? Front of package labeling supported by public education of both adults and children and population as a whole for nutrition policies. The FOPL regulation should be framed as per consumption practices of the individual country. There is a need to generate awareness about critical indicators like color, size, taste, flavor, nutrition level, calories, etc. for analyzing food quality and safety. Good publicity in social and print media to emphasize the importance of nutrition and FOPL and regular food choices. The role of professional associations like IAPSM, IPHA, Indian Academy of Pediatrics, Association of Family Care Physicians of India, and WHO is also very crucial in form of having a dialogue with the industry along with WHO and issue the advisory to Government of India. Thank you so much. Thank you.
Thank you, Professor Sunila, for elaborating the managing NCD through effective front of package labeling. And now, as already said by Dr. Neeraj, we will taking the questions at the end. But in the meantime, you can write down on the chat box your questions, and they will be answered at the last. And now I invite Professor J.S. Thakur, who is going to speak about the role of public health professionals in FOPL and managing NCDs. And Dr. J.S. Thakur is the President, World NCD Federation. He is the expert member of Mission Screening Group, National Health Mission, highest policy making body of Ministry of Health and Family Government of India. He is the chair of first World NCD Congress held at Chandigarh. He provided consultancy at international levels in many developing countries, including Maldives, Sri Lanka, Timor-Leste. He is among the top 2% scientists globally, as published by the PLOS Biology 2020. He is a member of India Expert Group of COVID-19 of MOHFW and Government of India. He is a collaborator for Global Burden of Disease Study by the University of Washington, Pew Study by McMaster University. He has more than 200 publications and 50 international projects. Now I invite Dr. Thakur to start his presentation.
So, am I audible?
Yes.
Yes, Dr. Thakur, you're audible.
So, thank you, Dr. Anmol and Dr. Neeraj for chairing this session. And please allow me to share my slides.
So you may please.
So my slides are visible?
Yes, Dr. Thakur.
You have to put it in the slides. Yeah, that's good.
So at the outset, I'm really thankful to Professor Negi, Professor Vikrant, and Dr. Anupam for inviting me to this very important meeting. And I also invite, congratulate all the senior colleagues who are present in this meeting. So I will be speaking on role of public health professionals in the FOPL in managing NCD, and my task has been made easy by the previous two speakers. So I'll avoid the duplication and I'll specifically focus on what is the role of public health professionals and a few of the case studies. We have already discussed in detail that diet is a major risk factor for non-communicable diseases. And we have also discussed that diet which is rich in total calories, saturated trans fat, sugar, and salt, they are the major risk factors for non-communicable diseases. But I would like to bring another dimension from our work in the state of Punjab for the last 20 years, where we have worked in air pollution, the water pollution, the soil. So what we have found that our air has become toxic because of many practices which we have in Punjab, like stubble burning, where Delhi people are quite aware about it. We have also done the studies on major wastewater drains in Punjab and also on the ground and surface water quality. So I can say from our study that the Punjab water has become toxic because of high use of pesticides and heavy metals. And due to this, our soil has become toxic, and all these toxins in environment are leading to toxic food chain, decreased nutritional content in food, and many adverse health effects which we have studied in details, which include among the mothers, more spontaneous abortions, stillbirth rate, congenital malformation, reproductive health effects. So I think as of now, we are struggling with the only key elements, but I am bringing another dimension, that is the chemical toxicity of our food, which is a major concern all over the country, and nobody talks about that. And in fact, we can move only to this aspect only if we are able to cater to the initial elements. Now, I think it is amply highlighted that this is the high time to act, and this front of food labeling. I'm very happy to share with this audience that when this front of food package labeling work was initiated during my tenure in the WHO, where a project was awarded to the National Institute of Nutrition, followed by a workshop. And it was found that mostly, the foods are not labeled in our country. And I also got the opportunity to participate in the workshop which NII organized. And, it was represented by all major players of the food industry. I do not know how many of you have the experience of working with the food industry, but they have a big power, the muscle power, and bullying also. So during this meeting, they made a lot of hue and cry, and they were totally against having this front of pack labeling. So, but at the same time, I think that was the beginning, and later on was taken up by the FSI to take it forward. But at the same time, I would like to highlight that the informed consumer is very, very important. And I think beside the scientists, it should also, become a consumer movement in the country so that it can put pressure on the government. Now, I think my previous speaker, they have, spoken about the evolution of front of package labeling system in our country. I would say that this is a journey which is taking us to nowhere. We have taken so much time in introducing this system in the country that it is still in the discussion stage, and we have not gone up to the implementation stage. Now, a little bit about this FSI draft regulations. They have been put to the public domain, and I'll request all of you to go through these domains. And my previous speakers, they have also highlighted that what are the problems with this, so we can give our suggestions by 19th November 2022. So that will be the real service if we really want to implement these front of pack labeling in our country. We should share our comments, concern, which are being highlighted. So as was informed that, this is how we have gone for health star rating. And Dr. Sunila has very amply highlighted that we are talking of health star rating in a country where 25% of the population is illiterate. And, this is a major criticism for the, labeling which we have gone. Now, what are the pros and cons of health star rating? We should also know that pros are that raise the overall nutritional profile of the packaged food, provide a simple way to compare foods with the same category, and more the star, the healthier the choice. But they can be, there are certain constraints which should be kept in mind, that HSR is based on serving suggestions. The healthy foods can have fewer stars than the junk food, The question does not consider the level of processing of or the raw ingredients, which is very, very important in our country, because you might have heard about this cola controversy where they blamed the water industry that water was contaminated. Score can be manipulated by adding healthy component in the ultra processed food, and only food in the same category can be compared. So stars can lead to a health holo because of their positive connotation, making it harder to identify the harmful product. And there is lack of enough evidence for star rating system, which we are adopting, and people are also criticizing the FSI for soft pedaling on this issue. Now, coming to the role of public health professionals, and I'm happy to say that in this country, our professional associations and some of the institutions, they have organized seminars on this important topic. And there is a need to educate and sensitize the stakeholder, gather the support and successfully advocate with the FSI, check the accuracy of labeling and better presentation, provide comments and suggestions on the draft regulation. And I think all our professional association in public health should make it as a movement, and they should do some contribution in this regard to flood the FSI with the comments which are expected by 19th November. There is enough time, and once a FOPL regulation is brought into effect, ensure that it is effective. We have taken almost more than 10 years for drafting the front of pack labeling, and I'm sure that we are good in making projects and plans and laws, but they are hardly implemented effectively. Now, we all know that we have many public health associations. I need not to tell to this audience that there are 6-7 professional association. World NCD Federation is working at the global level, and we have presence in India. We have IPHA, IAPSM, Public Health Foundation of India, Indian Society for Malaria and Other Diseases, Indian Epidemiological Association, Epidemiological Foundation of India, India Medical Association. There are other relevant associations. So what is I think these association role is very, very important. And we really need to engage with the multiple stakeholder. And it was highlighted that front of pack labeling is not the responsibility of one ministry, but many stakeholders are there. We need to have advocacy meeting with the key stakeholders, consortia, and working towards a call for action. And I think after all these deliberations, we should come up with a call for action. We need to have more awareness workshop on the food safety measure. I think that this is important to engage the consumers in this country. We should make it as a consumer movement so that people demand that there should be FOPL. Training of healthcare workers, and also to change the medical curriculum and introducing about the FOPL, empowering the consumer to make healthy choice, and effort to catch the children young and make them aware about the industry is very smart. They have, very catchy advertising for the children. And all of us know that all good and bad habits are formed in childhood. So if there is any best intervention, it is the school-based interventions for NCD, which is important. We all are aware about this Eat Right India initiative, which is there, and the focus is on eat healthy, eat safe. But we have a question here, rather that whether really our food is safe. So I think all of us need to bring this into focus. I have few more slides. I would like to acknowledge the contribution of World NCD Federation, which is a professional association working for non-communicable diseases at the global level. And we have been trying this and highlighting the FOPL issues from the very beginning, and our effort is to promote the public health approaches for non-communicable diseases. We have also initiated a global health and wellness initiative, and the theme of this English is play, laugh, and grow. And Indian version is Khelo, Haso or Hasao, Bado or Badao India. It was launched by the Bandana Gurnani, Additional Secretary, Ministry of Health and Family Welfare last year. Khelo here means that we have to have enough physical activity beside healthy diet. And Haso or Hasao means that we should make people happy and ourselves be happy, a positive attitude for life. And Bado or Badao means the whole of the society and whole of the government approach. Now we have also World Institute Federation conflict of interest policy, which is on our website, and we do not accept any money from the food industry, the alcohol industry, tobacco industry, the pesticide industry. That is our mandate, which we are maintaining for the last 7 years. I'm also happy to share with you that glyphosate is one of the pesticide which is carcinogen, and it is almost 50% of the pesticide which is being used in Indian states. We made a presentation to the Farmer Commission of Punjab and got it banned in the state of Punjab. But unfortunately, it is available in other states. So farmers, they need to be made aware by the agriculture universities and the stakeholders. Of course, we are doing our job, but this carcinogen is being, used by most of the paddy growing states, and it need to be banned. Similarly, we have the problem of adulteration of milk and milk products. So whatever milk we are producing, about 5 times of milk and milk products are available in the country. So from where these milk products are available. So I think we also need to go into this aspect, that this is a problem, and we took up this issue again with the Farmer Commission of Punjab and gave them a master plan that how it can be, improved at the. Now, I would not go into detail of some of the experience, but I would say that I had the opportunity to study the system in Thailand. And they have a very good system, and this is one country in Southeast Asia. They are really doing very good as far as FOPL is concerned. They have a traffic light system, red, amber, green, highlighting that the quality of the food. Similarly, the Sri Lanka is also using this system, and they are effectively implemented in that country. And the positive effect of this legislation, which has been studied, there is a reduction of the sugar level in many beverages within a short period of time, raised awareness among the public about the sugar level and health effects, and industry took new initiative. And I think Chile's story has already been told by Madam earlier, so I need not to go into details. We have many challenges. I would say that this FSI, which is a regulator, they have to be more aggressive, stringent to ensure that we are giving safe food to our people. There is a lack of professional education, lack of awareness, false labeling, limited analytical facilities. I think we do not have enough facilities to check really, the false labels in our country, and diversity in the existing system and the nutritional standard. And also, we have to make this aggressive food industry to comply to. So just to summarize that health professional has a very critical role in promoting FOPL with the rising prevalence of NCDs and related deaths. I think this is the high time that we should focus on this issue. And I would like to, emphasize here that once they are notified, we should come up with an implementation framework and roadmap, and we should ask FSI that these rules should be notified. The consumer activists and the NGOs should be motivated. There should be, there is no question that there should be a mandatory FOPL in the country, and strong research is required. And I would say that we have now enough seminars in the country, and we have to come out on the roads and to speak on this issue. I have earlier spoken in some of the meetings organized by the other aims. This is the high time that our association should go to Jantar Mantar and protest. Friends, we have to be activists. It is not only the seminars which are important, but we have to lead on front and compel the government and also make the consumer aware that it is our right and we should have the right to have good food in this country. I also take this opportunity to invite all of you to the 3rd World NCD Congress, which is happening in Toronto in Canada, with the theme Equitable and Sustainable Health for All. And the dates are June 25th to 30th. We have already shared the abstract submission is open, and we will also discuss the issue in that meeting. So with this, I'll stop here. And once again, thank you very much for patient hearing. And if there is any question, I will be very happy to take.
Thank you, Dr. Thakur. Do we have a time, Dr.
Sir, we have already overshot the time, sir.
Okay. So we can conclude it with one more invitation. That we are hosting a IAPSM Golden Jubilee this 23 to 4 February at AIMS Vivinagar with the collaboration with NIN. So I ask everybody to please register for that. Already registration is open, and also ask your junior resident, senior resident, and other faculty member. Ask them to register. Already Dr. Anmol has registered there. Okay, so I asked Dr. Anmol to just inspire other, because Shimla goes as a full group. So I hope that we can host you here, not that cold here at that point of time, but the weather will be very good for you. With this one, I hand over the mic to the Dr. Anmol.
Thank you, Dr. Neeraj. We had a team of 15 to 20 participants who are coming from Himachal to attend this conference. And
thank you, sir.
It has been a pleasure being all with you. Thank you for Dr. Pankaja, Dr. Sunila, and Dr. J.S. Thakur. Thank you for your presence. I wish a very good evening to all. Thank you.
Thank you, Dr. Anmol, Dr. Neeraj, Dr. Bharadwaj, and the hosts, Executive Director, and the Dean. And important thanks go to Anupam, for taking the lead, and AIMS Bilaspur has taken the lead in this direction. Thank you so much. Thank you.
Thank you all, and thank you, Anupam, for taking a lead and bringing AIMS Bilaspur also in focus at the national level. Great work.
Thank you, Anupam, and your team. And congratulations to you for organizing this webinar.
Thank you, Mamita. We have been joined by Mission Director, National Health Mission, Shri Hemraj Bharva, IES. So I welcome sir on this platform and request Dr. Nikita to please share the slide and conduct the session. Sir, Dr. Thakur, sir, please stop sharing your screen.
Okay, so moving forward towards the second scientific session of the evening, I invite our first chairperson for the session, that is Professor A.K. Bharadwaj, who is Professor Emeritus at Medical College and Hospital at Solan, Himachal Pradesh. Sir has worked as a professor in community medicine in medical colleges at IGMC Shimla, RPGMC Tanda, and RKGMC Hamirpur. He is the chairman of National Task Force on National Tuberculosis Elimination Program since July 2021 and has remained National President IAPSM in the year 2014 and 15. He is a fellow of IAPSM and IPHA and has delivered many prestigious orations like Dhanvantri Orator, Harcharan Singh Orator, Vasudeva Orator, and N.K. Vaidya Orator. Sir has over 150 publications and has 41 projects. His area of interest include tuberculosis, epidemiology, non-communicable diseases, family medicine, HIV/AIDS, reproductive and child health. Our second chairperson for the session is Professor Dr. Milap Sharma, who is the professor and head of Department of Pediatrics at RPGMC Kanga. Sir is an alumnus of IGMC Shimla and has a working experience of over 30 years. He has special interest in pediatric neurology. He has remained past president and past general secretary of HPIAP. He has publications in many prestigious national and international journals. So I hand over the session to both the respected chairperson.
Thank you, Nikita. Can I start?
Yes, sir.
Yes, sir, please.
Yeah. So first speaker, yes. So good afternoon, sir. So I have the privilege in introducing our worthy mission director, National Health Mission, Himachal Pradesh. So he is engineer by profession, did his PTech in IIT Kanpur. He has formerly served as Additional Deputy Commissioner Chamba, Special Secretary Higher Education, Department of Education, Government of India. He was DC Kinnaur also. From DC Kinnaur, he was shifted as the Mission Director in National Health Mission, Himachal Pradesh. So this is what you people know, but now Dr. Verva is spearheading the TV-free campaign in Himachal Pradesh, and under his leadership, we hope that we will achieve that status in 2024. And this year, we plan to make 3 districts TV-free in our state. So we are working as him as a team leader for this campaign. So I must emphasize here that though this topic is not my interest, my interest solely is now tuberculosis, but I must emphasize here that in the best interest of public health of our country, there is a dire need of strong and effective front of package level for food which is based on scientific temper, follow proven global best practices in the country's health and nutritional needs. So as a strong supporter of Health and Fit India, we firmly believe that a quick action in this regard will help India set the Indian example on the global health and nutritional map and set a precedence for other countries as well to follow. So here I must say that as per our Pradhan Mantri TV free जो अभियान है जो उसमें the corporate, the NGOs, the other agencies and the individual, they are adopting patients for providing nutrition to these people who are affected by tuberculosis. I don't say them as TB patient, but I always say them the person affected by tuberculosis. So if these people have to have nutrition packets from the donors, then we must have these packets with levels showing what they are getting, what either major elements, the minor element and the trace element they are getting. So this FOPL become a very, very important factor in our field also. So without wasting time, I invite Dr. Mr. Verva to give his presentation. Dr. Verva, sir.
Thank you, Dr. Bharaj. Thank you, Dr. Anupam, for inviting me to this webinar. I hope I'm quite clearly audible.
Yes, sir. Yes, sir. Please.
So concerning the topic of the webinar, which is some kind of which relates to some kind of awareness in general public about the basic source of NCDs, non-communicable disease burden. And a presentation has also been made where examples have been cited of Sri Lanka, Thailand, and Chile, where those state government have done something special in respect of the labeling to let people know what they are eating and what is a danger sign for them. So we are discussing on this very topic. As a government partner in promotion of health, eradicating the non-communicable disease burden, I also feel that the health department as such, or the health sector as such, basically caters to the problems created by habits, or say from several partners, and that this product is unsafe, or this much quantity is safe for you, you should not do, you should not eat junk food or whatever. We just advise regarding prevention of NCDs, but we are not able to really make dent to the sources of NCD. And the topic that has been chosen for today's webinar, it basically tries to enhance or tries to delve into the details as to what more can be done to prevent the spread of NCDs, which is spreading, as we all see the global burden of disease report is that NCD is increasing in leaps and bounds. Even NFHS survey has also, this time these questions have also been added to NFHS. Probably after 3 years we'll be able to see the increase as well. So definitely we need to really put in efforts which are more than just advice, and this is one. Here, what I would like to point out, that already the nutrient information, or say ingredient information, is displayed by all the product manufacturers. But we really need to work out and find out a way. And I will say there may not be a single way of addressing the issue of labeling. There can be many other ways of doing it. We can think of labeling for different category of products in a different way. We can think of region-specific labeling as well. We can think of because India is a diverse country, and understanding of people across the spectrum varies a lot. So maybe a high-class person would care to read every piece of detail written on a paper, but another end of the spectrum, people won't even care to look at what is written over there. They're just interested in what is there, and that's it. So we really need to deliberate upon these issues. So first and foremost thing that should that comes to our mind is that labeling thing that we had advocated in tobacco control program, and we tried and we were successful in getting maximum space for labeling, health labeling in case of tobacco. So there almost 85 to 90% space is for the health related labeling, and rest of the space is left for the product manufacturer. Probably it may not be possible कि हमको इतना space मिल जाए, but we should really think of getting more and more space so that whatever you think of as a label would have impact on the consumer in terms of visibility, in terms of its comprehensibility, and it will also give a leeway and for us to, or say, for health people to really work out as to what we should put in as a label, health related label, for consumer to be able to really make out as to this, whether this product is healthy, or should he use a caution while using the product. So that is one thing. Second thing that comes to my mind is because NCD burden is such a slow thing which takes over the person's health in in a very longer run, and the person himself or herself is not able to really gauge the impact of the product that he is eating. So we really need to think of innovative ways of designs for the label. We can even think of holding campaigns, or say there are a lot of talent available in the colleges and schools. We can think of holding campaigns to find out suitable designs, suitable kind of ways in which labeling can be so that we can really crowdsource the idea and get best of the inputs from across the board. That's all I would like to say at this point of time. Thanks again for inviting me to join in this webinar.
Thank you, sir. So your wisdom and your views will help a lot, and we hope that the government of Himachal Pradesh will provide a full support on these issues. So thank you very much, sir. And without wasting time, I hand over to Dr. Professor Milab Sharma.
Thank you.
Thank you, sir. I am very thankful to Professor Negi, Executive Director, All India Institute of Medical Sciences, Bilaspur, Professor Sanjay Vikrant, and the organizers, Dr. Anupam Prashar, for giving me this opportunity to chair this second session on very important topic, that is FOPL. I'm sorry, there's some problem in my connection. Yes, now it is okay. So am I audible?
Yes, sir. Yes, sir.
So it is my proud privilege to introduce Professor Kapil, who is Professor in Epidemiology and Clinical Research, Institute of Liver and Biliary Sciences, New Delhi. And he has lot many academic distinctions and awards. He received BC Srivastava Indian Council of Medical Research ICMR National Award for year 1992. He has received MK Seshadri ICMR Award for the year 96. He received Har Gobind National Award for IAP for the year 2009. And along with this, he also got Senior Scientist Award, Nutrition Society of India in 1992. He has been elected as Fellow of National Academy of Medical Sciences in 2003 and elected as Fellow of Indian Public Health Association 1993. He has been conferred Fellowship of Indian Association of Preventive and Social Medicine in 1998. So now I request and over to Dr. Kapil. Sir.
Thank you very much. I am so happy to be part of this webinar. I'm working in this field for a long time. So kindly grant me permission to share my screen.
Yes, sir. Yes, sir. You may share, please.
I can share that?
Yes, sir. Yes, sir.
Okay. Well, I would like to be very, very brief about this FOPL and nutrient profile model. Dr. Bhardwaj, Dr. G.S. Thakur and other colleagues have mentioned in detail about FOPL. I just like to reiterate that we have tried to develop the nutrient profile model for the country. This was done in about 2012 and 13. And this was a teamwork. And what we developed in our country was pre-tested, was also pre-tested in Southeast Asia, all the 9 countries, actually 11 countries. And then a model was developed which can be utilized by all the countries. Now, if you look at WHO has been trying to push this, that we should have a nutrient profile model, and this nutrient profile model would help us in developing a FOPL, front of package labeling. And there are different schemes for developing front of package labeling, star rating, then we have some black, white spot rating, some we have, there are different types. So I'll just try to put down my presentation is briefly in maybe about next 10 minutes on what is nutrient profiling, what's its utility, what are the components of nutrient profile model, how we developed it, and a small concluding comments. Okay, I had to put down in this mode. I'm sorry about it. Now,
Excuse
yeah.
me, sir. Sir, can you make it full screen, please?
I done it.
No, sir, it's not full screen. Sir, slide share mode.
Slide share mode.
Yes, sir. Third one.
Third one from which side? I put
down. Yes, on the taskbar, sir.
I'm sorry.
Sir, on the taskbar. Third one, you please click. Down, down, sir.
Slideshow.
That is
Yes,
slideshow, yeah.
Is it okay?
Yes, sir. From current slide. From current slide, sir.
Okay, fine.
On the left, sir.
From
Yes,
the
sir.
current slide.
Yes, sir.
Okay.
Yes.
Life is a learning process. We keep on learning from left side, right side, and so on and so forth.
पर अभी भी नहीं आया.
नहीं हुआ, sir.
It should come now.
Sir,
Is it
please
not
wait
there?
5.
सर दोबारा शेयर करो एक बार दोबारा.
यार भारद्वाज साहब आपने अच्छी तरह से नहीं पढ़ाया, ये कह सकता हूँ.
Please, sir, please press
आप
F5.
दोबारा से करिए, फिर से शेयर करिए.
फिर दोबारा शेयर करोगे तो आ जाएगा सर ये.
जी, और फिर then click it on the slideshow नीचे.
यार ऐसे नहीं दिख रहा मैम.
सर दिख रहा है सर, वैसे तो दिख रहा है सर.
इसका फॉन्ट वो बढ़ा दीजिए फिर ना
व्यू में बढ़ा देता हूँ.
50% से ज्यादा कर दो. हाँ जी.
Yes, sir.
Is it okay?
चलेगा.
हाँ चला लो भाई.
Sir, this one, yes, sir.
Is it okay?
Yes,
Is it
sir.
okay?
It's okay.
So, sorry for all technical glitches. Now, what we have basically, if we look at WHO wants that obesity and diet-related NCDs should be reduced. And for that, we need to have a nutrient profile model. And different studies have documented that salt, sugar, and fat, these are 3 important components in our diet, which are leading to non-communicable diseases. Now, with this thing, they have this concept is a very old one with WHO, and no other country in the world has developed the nutrient profile model except we had for Europe. European countries, for the entire Europe, they had a nutrient profile models. And this was essentially for 2 reasons: for prevention of diseases, and second one was promoting health based on the composition of food. This was a very important thing, which they tried to do it. And what they were doing, that WHO is very careful. They were trying to categorize foods which has nutrient content, which are healthy, and which are less likely to be healthy. Now, just see, they're not talking about harmful or other things. They talk about the healthy and less likely to be healthy in a part of diet. Now, it was also thought that nutrient profile model would help consumers to make the healthier food choice, although we do not have that much of a literate population. But once we develop the nutrient profile model, it will also help with product labeling. It will help in educating the population about the different food products. It helps the consumer to understand the nutrient composition. In fact, we also, after I did this particular project, I also started reading the composition of food, whether it is how much sugar it has, how much sodium it has, because there are certain inherent diseases which everybody gets after 60 years, almost 50% of us get it. And again, what was done was that to classify food healthy or less likely to be healthy. That was a major objective. And what was done was those foods which had a high level of sodium, free sugar, saturated fat, and total fat, they were considered as not part of healthy diet. That's something which is important. And as I mentioned to you, we developed this nutrient profile model, and then it was extrapolated to the entire Southeast Asia. Now, we don't develop these cutoffs just like that. We take up the WHO guidelines, like the total caloric intake from free sugar should not be more than 10% of the total energy intake of a population. If a person has 2000 kilocalories requirement, that means 10%, 250 gram, the maximum of 50 gram of free sugar he can consume in a day. So if you look at the calories, if the food is providing 300 kilocalories, that means 30. 30 means not more than, say, 7.5 gram of sugar should be there. So that if it is more, that means it is unhealthy. Similarly, the WHO guidelines are there that we should not take more than 2 gram of sodium, which is 2 gram of salt, which is equivalent to 5 gram of sodium salt. That means we should take only 1 milligram of sodium per kilocalorie consumed. If you're consuming 2000 kilocalories, then 2 gram of salt should be done. Similarly, the intake of fat should be 30% of total calories. This is something which these are the basis, scientific basis on which these nutrient profile models have been developed. Now,
sorry to interrupt, please. Sir, your slides are not moving.
Really?
Yes, sir. So please make it 50% again and then share. And then move the cursor.
क्या हो रहा है यार?
अभी तो सर साल्ट शुगर और फैट पे अटकी हुई है ये.
हाँ सर, अब हो गया सर, हो गया.
क्या यार, ये क्या अभी ठीक है?
हाँ जी सर, अब ठीक है सर.
Okay, right. So we had talked salt, sugar पे अटकी हुई है. Okay, now what we did was to develop this model. We did the market survey, and these are the different products which we have available in the market, because we can only do it for the packaged food. We cannot do it for unpackaged food. So this was something which was done, and we collected about 1100 packaged foods. Then what we did, we calculated and we entered the nutrient content in an Excel sheet, and per 100 gram available in the packaged food was considered. And then we looked into it, that which are the foods which are high in salt, sugar, and fat. Now what happened was, as I mentioned, it was more than a cutoff. We included as excessive. If it was less, then it was considered as healthy. Now, what we found that some of these chips, they don't mention at all about the sodium content. They talk about the fat, but they don't talk about the sodium content because we do not have a strong FOPL system. Now, for each country, if we are developing some guidelines, then we have to follow the Government of India guidelines. So we picked up the ICMR guidelines for India. And then we talked about, we considered all their different parameters, and then we tried to develop the cutoffs. Similarly, we took the dietary guidelines also. And again, if there were more than a particular cutoff, then it was considered as a unhealthy food, not unhealthy, less healthy food. Now, again, we tried to put down all the parameters as mentioned earlier, and then we put down the nutrient profile model for the country. We tried to look into, we developed a pilot draft. We had a technical meeting. We called a meeting of all the 11 countries, representatives, and the model was developed. And it was again field tested in about 5 countries. Their feedback was taken, and then finalized Southeast Asia model was developed. This was a model which we developed. This is one of the achievements of Southeast Asia region, and it has been followed in almost. I did a little bit of, they acknowledged me because it was a collaborative teamwork. So it was basically acknowledgement was put in. So this is what it is. The nutrient profile model is a simple tool by which we can talk about that these foods are healthy and these foods are less likely to be healthy. This is one of the approaches. We cannot decrease the non-communicable diseases by only adopting FOPL or the nutrient profile model. It has to be a part, one of the comprehensive part of it. When you look at the children's diet, and then we look at that how much they are consuming, and these fast foods, the packaged foods are become part of our culture, and they have to be utilized. And a lot of controversies are going on regarding the what should be the nutrient profile model, and the industry wants to have their say, which is convenient to them, and we want, scientists want the correct, valid cutoffs, but we will not win. That's my personal thing, and maybe I might be wrong, but the funds available with the industry are very, very high. We don't get even the travel to go to the FSSAI for our meetings, but they get almost, they hire the lawyers, which takes about maybe about 5 lakh rupees per sitting of the FSSAI. Well, with few words, thank you very much for inviting Dr. Anupam, Dr. Negi, and all the organizing committee members. Thanks a lot.
Thank you, sir. Thank you very much.
Thank you, sir.
Next, Professor Kapil, for very, very informative talk. You have covered every aspect and everything has been narrated in a very concise and clear way. As you have already told, it is need of the hour to take care of NCDs. Otherwise, whole progress of controlling the infectious diseases and thus decreasing the mortality will go waste. Thank you, sir. So any questions, queries from the participants? Welcome.
Arshdeep, do we have any queries in the chat box?
No,
I'm not yet.
No.
Okay.
So, Milav, we should conclude this session.
Yes, sir. So, sir,
Okay.
over to Anupam now.
Before over to Anupam. So I must congratulate the team AIMS Bilaspur, because for me it is their maiden activity and they did it with a style. So I compliment the director of the institute and the dean of the institute and the team of community and family medicine under the leadership of Anupam Parashar. So we will have more such type of activity in future, and hope we will be benefited by the current policies and program of the country. So I take this opportunity to thank Madam Sunila Garg also, and my mentor at least, Dr. Umesh Kapil also, and all other, and above all, Dr. Pradeep Agarwal,
Yes.
who is also the architect of this project. So thank you very much.
Thank you, sir. I thank both the speakers and the chairperson for a very enlightening session. Now I invite Dr. Anupam Parashar to deliver the vote of thanks. Over to you, ma'am.
Okay, on behalf of Department of Community and Family Medicine, AIMS Bilaspur, it is my proud privilege to propose a vote of thanks. First and foremost, I would like to thank our worthy director, sir, for kindly gracing the occasion and sharing his motivating and inspirational thoughts and blessing us all. I extend my gratitude to Mission Director, National Health Mission Himachal Pradesh, for kindly consenting to be part of this webinar and sharing his vision for Himachal Pradesh regarding regulatory provisions for FOPL. Department of CFM extends its thanks to our Dean sir for his active support and guidance always. I am really blessed to have such a wonderful and learned chairperson and speakers. I mean Dr. Bharadwaj, Ma'am Sunila, Dr. Umesh Kapil, Dr. Anmol, Dr. Neeraj Agarwal, Dr. Pankaja Raghav, Dr. J.S. Thakur. They have all been my teachers, mentors, and guides. And I am the most junior amongst the people present here. So I'm really blessed that they all agreed to share their views in this very important webinar, and they spared their valuable time. And I shall be failing in my duty if I do not extend my thanks to Dr. Pradeep Agarwal, Project Lead, Healthy Food for All, who was instrumental in making this webinar happen, along with Arshdeep for his support for this webinar. My thanks are due to IT team AIMS Bilaspur, especially Dr. Yatiraj Singhi for his support. Last but not the least, I thank each one of you for joining us for this webinar and hope that the discussions and presentations will be useful to all of us. In the end, I would like to convey that I am really blessed to have very cooperative, enthusiastic, and sincere faculty members and staff in Community and Family Medicine Department at AIMS Bilaspur. Without their effort, this webinar would not have been possible. On behalf of Department of CFM, thank you all once again. Thank you.
Thank you, Anupam. Thank you, everybody. Now you know why I was telling I will speak. I will not be a chairperson. She said, no, you'll be chair. I said, no, I will speak. Thank you.
No.
Dr. Anupam,
Yes,
you request
sir.
all your faculty members to apply for the membership of National Academy of Medical Sciences, who have completed 5 years after MD,
Sure,
and
sir.
so that they can become member of National Academy of Medicine.
Sure, sir. Sure, sir. Thank you so much for giving us the opportunity, sir. Thank you, sir. We are really blessed.
Bye-bye.
Department of CFM is really blessed, sir. Thank you so much.
Thank you.
Thank you, everyone. Thank you, all the chairpersons and all the speakers. Ma'am Sunila, thank you. Dr. Bhardwaj, ma'am. Sir, thank you all.
You can click one picture to Dr. Kapil joined late. I think you can click his picture as
Yes,
well.
yes, sir. So please switch on your videos. ED sir, please, with your permission, please, we can switch on the video, please.
Ma'am, please stop the slide sharing so that we can capture all the.
Yeah.
May I request everyone to please switch on their videos, please. Dr. Thakur, sir, please switch on your video. Dr. Pradeep.
Anupam, I learned one thing in NHFW. Photographer says hey, then participants say he. That's
Actually, ma'am, participants are on the YouTube link. Here we only have resource persons with us. We can click one picture then. Ashdeep, please ask Dr. Pradeep to join.
Ma'am, sir is in a meeting now.
Okay, okay. Okay, now we can click Ashdeep. Please click one.
Yes, ma'am, done.
Thank you. Thank you. Thank you all. Thank you, everyone.